Grafting is different from flaps, and I want to make that distinction very clear. A flap is a physical cut where we remove the tissue, it has blood vessels attached to it, and we sew those blood vessels back together in the chest so that the fat that I have transferred is alive and has blood flow. Fat grafting is distinctly different. That is liposuction with a long cannula, and you're moving that back and forth and you're pulling out fat. The fat is washed and prepared and re-injected back into the body using a needle. So these are little small incisions. I think of fat grafting is like if you're getting an ice cream on a hot summer day, right? Pick your flavor. Do you want to use your own tissue or do you want to use your implants? Fat grafting is like the sprinkles, right? Or it's what you're going to add to anything else that you've had done to make it better. Fat grafting can be done with flaps. I do it all the time. I'll do flaps and then I'll use the liposuction in her full capacity to sculpt out where I've already done the flap operation, usually the tummy or the thighs. And then I will fat graft onto the flap so that it's fuller or you get more cleavage or has more upper pole fullness. I can do the same thing with implants. I can do an implant reconstruction, liposuction where you want me to, and then inject that fat back in. Fat grafting does not have an inherent blood supply. Flaps do, right? I'm sewing blood vessels together. That's why it's called microsurgery. I do it using a microscope. Fat grafting, any plastic surgeon can do. And you are expecting the host environment where you are injecting it to be healthy enough that it adopts the fat and grows blood vessels into it. That's why fat grafting will never have 100% take.